So this is one question. Who need immediate intervention? In every prioritization question, you're looking for things, you have to be sharp. That's what we call it. You have be sharp. Check my prioritization, this thing, lecture that has things on what the B sharp means. You're looking for things that will kill the patient. So the B is the breathing, the E is electrolyte, S is shock, uh, then shock and sepsis, H is hypothermia and hypoglycemia, A is airway, which is number one, R is neurological problem, and P is pain. So you're looking for things that may kill the patient. Sometimes you may not see the same thing in the question that relate to B sharp, but it requires you to think. If you think that way, you may always relate it back. So what do we have? The best way to answer prioritization question too, don't look at the diagnosis too much and just forget about what is exactly is going on. Here they said a client on Coumadin and a tarry black stool. Coumadin, what is the problem with Coumadin? Bleeding. The patient has tarry black stool. This is not normal. That is upper GI bleed. So this patient needs to be seen. His bleeding will go into shock. That's part of the B sharp. A client on spironolactone and a peak T wave. What is happening? Spironolactone, you got to bring your content. It's a potassium sparing. Now we have a patient with a peak T wave. What is peak T wave on the EKG? It's related to what? Potassium. Therefore, if the patient has spironolactone, it's increasing patient potassium, and now a peak T wave, this patient needs to be seen. And it's part of the B sharp, like I said. It's still part of the B sharp, which is the electrolyte. A client with SIDH prescribe 0.45% sodium chloride. What is SIDH? High level of ADH. What does ADH do? It tells the kidney to reabsorb water. And so when you reabsorb water, urine output is low. Your urine specific gravity is high. Your serum osmolarity is what? It's going to be low. And your sodium is going to be low. Patient is going to be hyponatremia, and therefore their sodium probably is like 130. And if you don't take care of it, they go into seizure. What you need to do is to replace their sodium with 3%. So any fluid that is not 3% or 5% is wrong. You restrict them free water, you don't give them free water. So 0.5% of normal saline, even though you're giving them a salt, is too low, it will dilute the sodium more. Therefore, this one need intervention, right? We're doing something wrong to the patient. Yes, SIDH, and should not prescribe have normal saline. I should give the patient 3 to 5% to bring their sodium up. Number 4, a client with dumping syndrome prescribe high carbohydrate diet. What is dumping syndrome? Dumping syndrome is somebody, this is normal colon and the stomach, small bowel coming like that. When they go to, people who develop the dumping syndrome, they go to bypass and they cut a little bit of the stomach. So this is what they left, small stomach, and they bring the bowel and they shunt everything, basically bypass everything. So when you eat, it's dumped right into the small bowel. If they eat a lot of simple carbohydrate, that is sugar, they get dumped into the small bowel, and this then dump into the blood, and your body will see high glucose. Therefore, it releases insulin. Insulin come and push all the glucose into the cell, and you become hypoglycemic. And so their symptoms is hypoglycemia. They will be jittery, sweaty, palpitation, all the signs and symptoms of hypoglycemia. In order to prevent it, you should not let them eat any carbohydrate that has simple sugar in it. So high carbohydrate is wrong. They eat usually they're on high protein, high fat diet, and high fiber diet. This will help prevent damping. Therefore, this patient need to be seen. So all four of them, something is wrong with them. This is intentionally set. As I did this question to show to you that something you have to learn how to recognize bad stuff, not because you're picking one answer from it, but all of them, four of them, they are all something wrong with them. And it's a clear demonstration of how you can put SATA in a priority patient. All of them are priority patients. And that is how you do it, how you prioritized. Any last question? So we have four clients, right? Present with the flu-like symptoms and small purple rash. So the way we do prioritization question here, we go for our acts, the same thing. SATA, who need immediate intervention? What is the case? It's over here. Four clients present with flu-like symptoms and a small purple rash on the chest. So our acts, we need to immediate intervention. Our case, they have flu and a rash, four of them. And a buzzwords, small popular rash, and flu-like symptoms, right? Which of them need intervention? So you look at it and say, I don't know, flu-like symptoms and popular rash. Then you look at the answers, it give you a clue. There's some medications there. So you have to know, based on the medications, you can figure out what is common about them. And all is sulfa drug. Sulfa drug. The sulfa drug, people will develop rash on the chest. Okay, if they take in it and they present with flu-like symptoms. If that happens, you need to stop it immediately. This is Stevens-Jones syndrome, and that will lead to severe rash, hypotension, desquamization. That means the skin will peel and they will die from dehydration. Therefore, we have to look and see who is a sulfa drug. So a client on allopurinol for gout. This is a sulfa drug. Therefore, if he has rash, we need to stop it. So this patient needs to be seen. A client on carbamazepine for tonic-clonic seizure. Yes, carbamazepine is used for tonic-clonic seizure, but does that answer the question? No. The question is here. Carbamazepine is a sulfa drug also. Therefore, we need to stop that. But you got to figure out what to do with the clonic. There's another alternative you can use, but we need to stop this. A client on furosemide for CHF. Yes, LASIS, which is furosemide, is used for CHF, but it's also a sulfa drug, and therefore we need to change it. The client on metronidazole for C. diff. Flagyl, metronidazole is used for C. diff, PO. But guess what? Metronidazole is also a sulfa drug, and therefore we have to stop. Patient is developing Stevens-Jones syndrome, and we need to take away all sulfa drugs. This question illustrates that you need to know all the sulfa drugs and the teaching. Teaching is photosensitivity, so they tell them not to go out without covering themselves, rash, they get a sunburn, sunscreen when they're going out and everything. That one is simple. But the Stevens-Jones is the most serious aspect of all sulfa drug. So you need to know that and recognize which medications are sulfa drugs and how to analyze them. And that is how we do SATA question. So that is how we do it. And that is how we do prioritization question in the SATA form. We used our analysis, we broke the question down, and then we answered the choices. Thank you for sticking around.